It is June and it is Scoliosis Awareness Month. And the reason why I want to talk about this subject, because it is our passion to help people with scoliosis. We have spent many hours, seminars, trainings to become experts in helping people with scoliosis. So the first thing I want to do is go over what a normal spine should look like. Now, when we talk about what normal posture looks like, let's take a look at the spine. From the side, we should see 3 curvatures just like this. And from the back or front, we should see the spine perfectly straight. That is normal. Now, when scoliosis is present, the spine from the front or from the back is shifted, twisted like this. It could be here, it could be in the lower back down here. So there are twists and shifts, and anything 10 degrees or more in terms of a Cobb angle is considered scoliosis. And what that does is it puts a lot of pressure on the nervous system. That means the spinal cord is twisted in there. It puts pressure on the nerves, and thereby the brain that controls everything in the body, such as breathing, your lungs, going to the bathroom, your legs working. Because there's so much compression there, it can affect those body parts and how they work as the scoliosis gets worse over time. So the most vulnerable time for scoliosis to get worse is between the ages of 11 and 14, especially in girls, and that scoliosis can double or if not even triple in terms of the amount of curvature. And the causes of scoliosis, it could be anything from hereditary, genetic, or it can be due to traumas, falls. It can also be due to stresses, bad posture over time. One of the keys to scoliosis is early detection. The earlier we can find and detect scoliosis in the spine, especially in childhood, the better chance we have to get the best possible correction. So in our office, in order to help people with scoliosis, we need to first start with a consultation, a very specific examination, and full spine x-rays. Once we gather all that information, we will then determine if we can help. And if we can help, there is a number of different things we can do in the clinic to help that patient. So we will go over recommendations at that time. The key to helping people with scoliosis is to actually change the actual posture of the spine. Now, for that to happen, we need to change the structure of the ligaments. So in other words, bones in the spine are held together by these ropes called ligaments. In order to be able to change a shift like this to a little less shift to a little less shift in the more normal position, we need to influence and change the structure of those ligaments. Just for example, it's like if you go to the orthodontist and you have a crooked tooth, the orthodontist puts braces on you. The braces will pull that tooth into the right direction. Now, the tooth is bone, your jaw is bone. Between the tooth and the jaw are ligaments, those ropes that hold the tooth to the jaw. And what the orthodontist is doing is the orthodontist is actually changing structure through the braces of those ligaments to get that tooth better into a more normal position. This is exactly what we do here, but with the spine. And we have all these different tables and pulleys and devices in the back to be able to do that. And 2 other key components to helping people with scoliosis in our office is also specific adjustments to the joints that are most misaligned in order to get motion into those joints, start to get pressure off those nerves. So then we're better able to get the spine into a better position through those different devices behind me. And there's also specific types of exercises and blocks and dendrils that people use at home that are assigned home in order to be able to influence these ligaments, or in other words, get that posture into a better position over time. So there's multiple steps that we do here to help people with scoliosis, and we have really good success in helping people not only get out of pain and getting the body to function better, but to start to change that curvature and start to influence that to as best as possible. So if you or any family member, friend that you have that has scoliosis, or you would like them checked, please contact our office at Precise Chiropractic Center, and we would be more than happy to help.